Okay, so why don't we call the meeting to order? We've got here, let's see, 1, 2, 3, we have a quorum. I think that Dr. Kearns and Dr. Westbizer will not be visiting tonight. So, but otherwise, I think we're all set here. So the first, I think the first item is to review the minutes from the previous meeting. Does anybody have anything to say about that?
No,
Would anybody like to make a motion to approve the minutes from the previous meeting?
I make a motion to approve the minutes.
Second,
What was the date on that, Jim? The exact date on that? Those?
10/27.
10/27/21.
That's great. Okay, good. Okay, so any discussion about that? All in favor?
Aye.
aye.
Minutes are approved. Okay, Jim, do you want to give us some updates about the COVID-19 situation in town, or do you want to do the budget first?
I'll just stick to the agenda, Mr. Chair, if you don't mind, kind of go through the budget, and get that out of the way. Just bear with me while I do a screen share real quick. And I'll do my best to keep an eye on the participants, but once I do a screen share, it's kind of hard to keep an eye on that. And Dr. Kenny, I did make you
I'll look at it.
a co-host. And if you see any people pop up, all I gotta do is hit admit.
Yeah,
I'll keep an eye on that. Okay, good evening, board members. Jim Willis, Executive Director, Tri-Town Health District. This is the formal budget presentation for fiscal year 23 draft. Each year, as the board knows, we review the preliminary budget in hopes that the board will bless it, move it on to the finance committee and so on and so forth. But there's quite a bit of information on here. I'll just do my best to go through. That's the agenda, that's the minutes. That's something different. So basically, this is a relatively light budget request as compared to previous fiscal years. It really only incorporates cost of living allowances for staff. Every other line item is level funded. We always level fund the fringe amount, which includes retirement, health insurance, workman's comp, retirement, and others. The town of Lee typically will not have an idea on what the fringe benefits will look like until probably February, when the health insurance and Maya kind of come together to figure out if there's going to be a significant increase in health insurance, decrease, or level fund. So it's subject to changing at some point. What else is involved here is, if the board remembers, we budgeted dollars last fiscal year for public health nursing. So that money will be level funded this year. That will cover the cost of private purchase vaccinations for the flu. Once we become a vaccine provider for the flu, we will receive a small amount of free state allocated vaccines once you become a vaccine provider to administer our own flu program, but it's very small amounts. It won't even come close to covering the needs for the seniors, the senior housing, the schools, the teachers, fire, police, municipal, and also public programming. So there's going to be quite a bit of a significant upfront cost for flu purchase of vaccines. And so we also purchased some equipment, medical refrigerator. And so that will be funds that we will have to level fund every fiscal year to help support the nurse program, because the collaborative grant that we got, which is that $4.1 million massive grant to create the Southern Berkshire Public Health Collaborative that actually funds the nursing salaries, that doesn't cover these outside purchases of equipment, supplies, vaccine, and so on and so forth. So, we're working with not only just the Tri-Town towns, but the other member collaborative towns now. So there's going to be some costs that we're going to have to be on the hook for every fiscal year. As I'm still letting people in and presenting at the same time. And I know this has come up recently. Tri-Town is set up by a service delivery percent. That's how That's how we differentiate the percentages of the budget allocation. If the board remembers, several years ago, we retooled that entire funding paradigm.
Hmm.
We moved from a population model to more of a service delivery model. It's
Eggnog?
based on a
Oh, I
3-year.
can't drink that anymore. It's way too high fat content.
If people can please mute their
Upsets my
phones.
stomach.
Thank you. So if the board recalls, that's based on a 3-year rolling average. So, and I'm going to show you the metrics in a few minutes. And even with the pandemic and some of the inspections and the services that we still deliver, it's still basically the same percent every fiscal year. And so, and if we see significant changes as we move along in fiscal years, we will make adjustments to the percentages of the budget. And the ARPA funding that all 3 towns are familiar with are funds that we were able to capture outside of the Tri-Town operating budget. This is the American Rescue Plan Act, where there's significant funding coming into every municipality. We put in 3 separate requests to be able to utilize and pay our FDA specialists to get Tri-Town credentialed to the FDA retail food standards, which is going to be a couple-year project. And once we're at that point, there's going to be significant more funds coming down the pipeline to help sustain Tri-Town as we move along. Very, very busy screen, but if you look at the top, you'll see salaries full-time, and where you see the FY23, that's a budget request. The column to the left is what we budgeted and approved at town meeting. So there's only a $6,800 increase in the salary full-time, and that incorporates one of our inspectors actually increased a grade change for meeting all his credentialing, which is an important piece of retention for especially municipalities. We're in this zone where everyone's labeling it the Great Resignation, and Tri-Town has been able to kind of not avoid that mass exodus of people leaving, and it's because we feel like we have a really good culture, and we were getting inspectors. We're investing a lot into staff and training and certifications, and now with the state really pushing workforce mandatory credentialing, that's going to be required further down the road. And with that, we have to try to be somewhat competitive to attract and retain staff. So that incorporates that. Everything else is level funded at the top. We level funded fringe benefits at 100,247. Again, that's a moving target that will change. The other increase is web permitting. That's our permanized web permitting. That's just a normal 2% increase to cover the contractor's cost for providing us the web program. And then further down, you will see compensation reserve, where we budgeted for $13,297, which is an increase of $5,300. That incorporates cost of living, step increases, employees that have been around a while, and longevity. And so it's right on pace, and the bottom line is a 3% increase, which is a very small increase. And that we feel with utilization of the ARPA funding, the shared services grant money, there's some more money coming there. This should not be a controversial budget request to the towns. It should be relatively straightforward.
Okay.
Any questions on that? Okay. This is a breakdown of the percentages that each town is allocated. Lee is 33%, Lennox is 43%, and Stockbridge is 24%. Again, based on the 3-year rolling average of the service delivery. And at the bottom, you'll see the actual increase from fiscal 22 to fiscal 23. Lee's increase is 2,800, Lennox is 37, Stockbridge 2,000. Very nominal increases across the board. If you're interested, this is our revenue metrics. And if you kind of look at the arrow, somewhere versus FY21, Lee, Lennox, Stockbridge, and totals, the total, you'll see each town for FY20 what we brought in for revenue, by type, then you'll see total, which is at 165,065, as compared to the bottom data set of 203,126. We've lost revenue for obvious reasons. When we look at the revenue types, we've lost 5,000. Let's see, so 3,000 or 4,000 in permits, a little bit in septic, and so we sort of knew this was coming. Last budget cycle, we actually increased revenue, but that was before we started to see the financial hit with all the shutdowns and limitations and gatherings. We bring in a significant amount of revenue. Well, I won't say significant, but like we bring in a chunk of revenue from all these food service permits during the summer and fall for special events, Apple Squeeze, Founders Day, the Stockbridge Arts Festival. A lot of that didn't happen this past year. So we hope, as knock on wood, we're coming out of COVID, we'll get back to the new normal and we'll start to get back to good revenue projections. But even though we've dropped a little bit, it's still relatively healthy with respect to what we've went through in the last 18, 20 months. This right here is a graph. You'll see as we start entering into FY20, we started to dip down a little bit. I really do anticipate coming back up. Hopefully things get back to where they need to be. That's just in total. And we peaked out at 210,000 a couple of years ago, which was our highest in a long time. And before that, you'll see it was at 121 in FY18. So we somewhat stabilized, but we couldn't control COVID. That's just a natural dip in revenues. Any questions on revenues? This right here, it's a busy chart, but this is our cost service allocation chart and more of a condensed model. So what you'll see is a data set at the top for Lee, then Lennox, then Stockbridge by fiscal year. And you'll see the total number of permits we've issued. We've categorized everything we've done, everything that we're required to do, whether it's housing, the large food service, the small mom and pops. We put these into classifications a few years ago. Level 1 inspections are the small square footage restaurants that may not take a significant amount of time. Level 2 inspections are sort of like the camp inspections that take a good chunk of the day, multiple inspectors, a nurse, places like Kripow, Canyon Ranch that take a lot of staff time to do. And we put together a cost center and we estimate that, like, what's it cost for an inspector to be out there per hour, the travel, the training, everything that goes into it. There's a cost center, housing, the septic work, our laboratory, we look at the total. And then what we do is we put the percentages in and we start to compare from town to town of the whole, what we get. And when you see at the bottom, you'll see, here's the percentages: 33.1, 42.1, 24.9. And then we do the 3-year rolling average. And if you look over to the right, our percentages are pretty spot on. That's fair and equitable for all 3 towns. And so we do this every year, this exercise every year. We do it multiple ways to make sure it's a fair and equitable reflection of what people are paying for the services that they're getting. You'll even see, I threw a little squiggly arrow in there, you'll see a little bit of a drop in total services. For example, in Center and Lennox is 1362, 899. That's because we couldn't do restaurant inspections because everything was closed. And so, and even still with COVID, the percentages are still coming out pretty accurate to where we had set them a couple of years ago. So that's basically the budget.
Can I ask you a question about that, Jim?
Sure.
Some of the services obviously will be lost permanently. For example, the restaurants, et cetera, that were closed during the COVID. What about, do you expect there to be any services that are going to rebound? For example, septic inspections or anything like that might have been put on hold and now are going to come back and require additional services compared to what you would expect? And if so, do you have to allocate anything for that?
So septic has been really busy in FY22. We know, obviously, we won't see those numbers until we close out this fiscal year. Septic is one of the busiest years we've had in a long, long time, I think, because of the market and a lot of houses selling. So that's definitely rebounding. Most of the food permits that we've lost, a lot of places haven't. I mean, we've had a few places closed down permanently, but others are reopening. And so, there's a couple places in Lenox, like the Lenox Inn, and there's a few other places that are up for sale, but other places are opening up too. So it's sort of, we should start to balance things out. We don't need to allocate any new resources, because we fund the department to where we were a couple years ago. And while some things were a little bit slow, the staff are out there educating the community on COVID and the masking directive and doing other things. We're getting a lot more complaints, but I really think things are going to balance themselves out. As we get into next spring and summer, we get into the next phase of the pandemic and hopefully it becomes endemic. We're going to start seeing more summer events. And if we continue to struggle next summer and next fall, similar to where we were this fall, we may not recover those special events. But I'm hoping as we start to transition to the next chapter of COVID, things will start to settle themselves out. But it's an ebb and flow, but it's pretty consistent over the last 6 or 7 years. We haven't seen significant drops other than the special events for COVID. Anybody else on the budget? And I'll just quickly go through some highlights and we'll wrap up. As the board knows, Tri-Town wrote a very comprehensive grant to create the new Southern Berkshire Public Health Collaborative, which gave multiple towns an opportunity for us to really start to roll up our sleeves and create a comprehensive public health nurse program. And we're getting $300,000 a year, hopefully for the next 13 years. And the governor just signed a new ARPA bill for another $200 million. And there's more money coming as we start to build workforce credentials. And, through the pandemic and even before that, there's just a lot of inequities in how health departments are set up. There are some towns that don't have any staff and some towns that have a lot. And then once the pandemic hit, Massachusetts did a very poor job responding to the pandemic. And while I think Tri-Town did really, really well, we never had a comprehensive public health nurse program. Like many other towns, we had limited part-time contracted nursing that didn't provide us a lot of services. And now the grant allows us to have full-time nurses to really start to drill into working with the inequity population, the most vulnerable population, and to really build a comprehensive program. It's really exciting. So we have 10 towns part of the collaborative, and really we're working towards building our own vaccine program, which is taking a little bit of time. There's a lot of red tape, and we're sort of beholden to the Department of Public Health because they're short-staffed too. And so as we start to do that and we start to provide more clinics, it'll start to become a sustainable self-driving model. This is really a quick summary of what the Southern Berkshire Public Health Collaborative is. Tri-Town in the town of Lee is the fiscal host. So we receive all of the grant money, but the nurses are providing services not only to Tri-Town, but the other municipalities. This is the 6 key functions of the Special Commission on Local and Regional Public Health. We've talked about this, about staff retention, building workforce credentials for the future, to really respond to the high need of public health. And we're really, Tri-Town laid the foundation for the last 93 years on shared services. We're the oldest health district in the Commonwealth, creating in 1929. So we wrote the playbook on shared services, and we're really working well with some of these other municipalities. As you see, for those that are part of our ever-growing email system on a weekly basis, we put out a weekly dashboard that we do a summary and analysis of what's going on with COVID. It's on the Tri-Town site as well as many other websites. If there are people on this meeting or going to watch the video from home, if you're interested in receiving and being part of that email chain, shoot me an email either after this meeting or tomorrow. It's just Jim, Jim at tritownhealth.org. If you want to be part of that email chain, we keep growing the email list. Let me know, and then we'll add you to that. If not, you can always go to the websites.
Jim, is the fully vaccinated group, does that include boosters or not?
It's a really good question. I don't think so. Yeah, fully vaxxed are the 2 doses, then boosters.
Two
I think.
doses, okay.
Yeah, and I think it's the way that the DPH is putting out the data.
Hank,
Okay.
if you look in the center panel of that screen where it says Southern Berkshire reported case, you're going to see down in the 3, there'll be the 3 different colors, the
Oh, yep.
blue, the orange.
Oh, yeah, there is vaccinated plus
booster. So fully
booster, I see that
vaccinated
now.
is the, the 2 for the Moderna, the Pfizer, 1 for the J&J, and then the booster would be the additional one, that gray one.
I got it.
It's very limited data because a lot of people are going to private pharmacies for the booster, and it's not necessarily getting into the state system. So it's very limited at best right now. Again, some other very quickly, we also, in the last year or so, received over almost $100,000 in federal CARES Act, which came directly to Tri-Town for the 3 towns. We helped all 3 towns on supplies, other costs, the $4.1 million shared services. We built a really strong public health nurse program. We've always had good relationships with the business sector, but I think we've strengthened that through the pandemic. We're trying really, really hard to try to work with our community rather than taking the punitive route. We have a lot of intercommunication. We've sent out literally thousands of emails on a weekly basis during the pandemic. And now with the dashboard, we're still reaching out to people and so on and so forth. We've always had good relationships with the school committees, but we really strengthened it with the schools. We meet with the schools routinely. We continue to engage in open dialogue on what's going on, the trends, policy changes, what we can do for the schools, how we can support them. Our public health nurses have worked at the schools on pool testing. Some of these smaller rural schools in South County don't have a lot of school nursing staff, and our nurses are really working hard helping schools with pool testing. So we know it's an important tool in the toolbox. The ability to respond to complaints. And I think we really had good compliance during the shutdown. And I think it's a good reflection of how well we built relationships in our community. Quick snapshot of COVID. This is through a few days ago when I had to send out the agenda, but these are the total case counts for the district broken down by town. I think we had way more than 400 phone calls, but it's just a lot of investigations, and we've updated the websites too for those that are looking for a booster, a shot. We have these links on our Tri-Town site. And lastly, just some other highlights that we're doing. We have good staff retention. We're investing in the staff. We know COVID's not going away. So as we build our nurse program, that will be part of our comprehensive public health nurse delivery system. Our household hazardous waste collection continues to grow. That gets really good participation. We do 2 collections a year. We basically have all of South County. We have 18 towns in that program. This past spring, we invited the town of Dalton in. They needed some assistance. They weren't getting a collection, so we invited them into the Lee event. That went really well. Once we launch our vaccine program, I mean, it's not a revenue maker, but it will help to offset the significant cost of vaccine purchase. So we're hoping as we build this program that we won't have to go back to the towns and ask for significant funding. It will fund itself over a longer period of time. And in relationships. Yeah, I mean, that's basically the end of my budget presentation, and I'll open it up to the board. And if there's no questions, comments, or concerns, I will definitely be asking for a motion to approve the budget and move it along.
Are there any questions from anybody about it from the board? Hank, are you raising your hand?
No, sorry.
Anybody like to ask a question from the board?
Jim, when will you have to move forward to go to all 3 towns? What are the dates of that? Because I know you always present to the 3 towns.
Well, I present if I'm requested.
Okay.
Typically, if the board approves everything tonight, I move the packages to all 3 town managers, and then they kind of take it from there. And then I just wait for a request to present. And once that happens, we'll attend a finance committee meeting. And if that happens, I'll usually reach out to the chair of each town to
Yep.
kind of go in as a unified front and have those conversations. It's been a little bit wonky the last couple of years with COVID, but I did present to Lee last year, and I think the year before was Stockbridge. Sometimes, depending on the request, and it's not a significant increase, they won't even ask. It's usually if you go outside of the scope of what they're looking for, you have to start to get into justifying what you're doing. But our entire budget increases standard cost of living staff increases. That's basically it. You know, we're not asking for significant new line items, significant increases to anything. It's probably one of the easiest budgets I've ever had to deal with since I've been at Tri-Town. You know, we're utilizing ARPA funding, and there's other resources coming in outside of Tri-Town. This is relatively just a maintenance budget.
Okay, so Jim, I have a question. You said you thought one of your accomplishments was strengthening your relationship with the business community. Now, can you tell the members of the board approximately what % of services, the expenses of Tri-Town go to the business community and the not-for-profits?
Yeah, it's a really good question. So we talked about this a few years ago when we retooled the entire budget. About 80 to 90% of our mandates that we're required to do are all commercial. You know, there's that small, like 10 to 15%, like private septics, housing, when we have complaints on housing. Most of what we do is really related to the commercial sector, restaurants, you know, the pools, the hotels, the motels, the beaches. It's all really high percent of commercial activity.
Okay, thank you, Jim. So if there are no more questions, I'd like to have somebody make a motion to approve the budget.
I so move.
Okay, a second on that?
I second.
second.
Okay, all in favor of approving the budget?
Aye.
Aye.
Okay, it's unanimous. Thank you, Jim. Now, the next item on the agenda is the COVID updates. Now, you already gave us a little bit of that. Do you want to summarize it again? Is Amy here by any chance? I didn't
No,
see her.
she's not. She's putting in a lot of hours this week, but she did send me the snapshot for all of Southern Berkshire of the updated COVID cases. What's in parentheses are unvaccinated numbers, and so you'll see December 5th to 11th, and it keeps going back. So we 17 last week, 15 the week before, 10 the week before, 15, 6. Lennox 12, 10, 8, 5, and 7. Stockbridge, pretty flat. You know, I mean, we don't have a lot of updates. We know about the Omicron. It is being reported into different states. We don't have enough information about it yet. Early reports is that it's highly contagious, but it's less of an impact on the person. But that, again, just the DPH is barely touching on that right now because they're still trying to figure out what that's all about. And outside of that, I mean, you know, and I know the masking directive is coming up next on the agenda, and I don't know if other board members have anything to weigh in, but like the nurses are still contact tracing. You know, there's a lot of schools are still doing pool testing. And I know some municipalities are looking at different local regulations, mandates, directives. I know schools are looking at possibly having a conversation about vaccine requirements. It's kind of all over the place. We know that Governor Baker came out the other day and said he doesn't plan on implementing any statewide mandates.
Mm.
And so, really it's the Berkshire numbers are pretty high, but they're high everywhere. But I also feel like we're in a different place now than we were last year, right? We have vaccinations. The majority of the populations have access to those vaccinations. The pediatricians' offices are doing vaccinations. The boards of health are offering school vaccinations. People qualify for boosters. And so I don't really have a lot of significant updates related to COVID-19 other than what everyone already knows. It's just, we're going to keep an eye on Omicron, and we're going to work with DPH. We're on multiple calls per week with DPH. Yeah, I mean, just we're not out of this by any stretch of the imagination, and I don't think it's going away anytime soon. And so we're going to be transitioning into a new normal. Contact tracing rules may change. Hopefully more boosters are going to be coming available. The state's giving out over 2.1 million home rapid tests for people to utilize, especially in underserved populations that may not have access to a test. And so it's just, we're still moving along, and we're doing the best that we can. We still get quite a bit of phone calls. We're updating websites where the nurses are spending a lot of time working with the schools. I know Diane and I are on a couple different committees working with the schools and providing updates and trying to support them as much as we can. We may be looking at a possible drive-through rapid test clinic. We're still working out some of the details there to maybe, if there's a need, to see if people would travel during the holidays, to see if we can get some folks some rapid tests. But outside of that, it's just I don't have a lot of new updates other than what we already know.
Any members of the board have any questions about that?
No question. Public health announcement, remind people to spread the word. BCC is having that big clinic this Saturday.
Which is full, by the way.
Oh, darn it.
Yep.
Okay.
Yep.
Okay, nice try, Diane. Okay, so now the next item is the masking directive review. Now, we went over this in detail at the last meeting, if you recall, and we decided after considerable discussion not to change anything at that point. So I'd like to ask the members of the board, or Jim, if anybody feels that we should modify what we decided the last time, offering any updates about it that would be pertinent to that, or possibly any amendments to the masking review. Does anybody have anything to say about that?
I think we should leave it in place as it is.
Yes.
I agree.
Hank.
If it isn't broke, don't fix it.
Mhm.
Right. We're not out of this. This is going on and on.
So you'd like to keep the masking directive review where it is?
Yes.
Everybody agree with that? Anybody opposed to it? Okay, now I just in terms of possible amendments, and of course, we just gone over the COVID updates and a few things. And I think that one of the things that I think is on people's minds, and I don't want to get into detail about this now, but I'd just like to hear a little bit about it so we could decide whether or not we think we ought to revisit this idea specifically as an agenda item in a future meeting. Diane, you brought up something that I think Dr. Wool was going to be discussing here, but I don't see him on our list here tonight of people here. Do you want to just?
I invite him in to talk.
And is he coming?
He's here.
He's here.
He's here.
Okay,
He's
so
got his hand raised.
okay, good. All right, I didn't see it. So please, Charlotte, Dr. Wool is going to be discussing something. You're ready to go if you'd like.
Yeah, I am, but I may be cut off at 40 minutes, so I don't know. I'll have to go back in, I guess, and I'll have to be readmitted if it cuts out. But anyway, and my Zoom panel only has my first name because I can't figure out how to get my last name on it. So it's Charles if you want to look at me, and you probably don't. But anyway, I do appreciate the opportunity to be here. As some of you know, I practiced medicine around here for 40 years. I live in Lenox, but I practiced in Pittsfield. And I'm currently the chairman of the reopening committee at Temple Anshiamunam. And I was a regular volunteer at the BCC clinics last winter. So I got a chance to meet a lot of people in public health around here. And I'm just totally impressed by all of you. I'm sorry that the office, Jim, got a lot of calls about what I'm going to talk about. I only told my wife because I didn't want to make any plans for tonight. But anyway, I am here to advocate for proof of vaccination for people who enter restaurants for indoor dining in Lenox, Lee, and Stockbridge. And I only became aware of this problem a few weeks ago. This is even before Omicron was reported about. I went into a restaurant, my wife and I, with two other couples, went into a restaurant in Lenox that had live music. And I just, I hadn't been in a restaurant in a year and a half at that time. I handed the guy at the front my vaccine card. He said, "Oh, that's not necessary." And I said, "Really?" And I walked in and everybody was unmasked except the wait staff. All the patrons were unmasked. Most of them were not eating or drinking, talking loudly, being well within 6 feet of each other. And I got very, very nervous. And because especially, I was thinking all the summer theaters required vaccine proof, even though everybody in the theater was masked all the time. All the museums were the same. Even the triplex theater requires proof of vaccination, even though you're not screaming at each other and being unmasked when you're inside the theater. So it really made me wonder about why we had to go into restaurants unvaccinated. Just about a week before this, I had been in New York City to watch my wife be in the New York City Marathon. And like many other municipalities, they require proof of vaccine. And you show them your card in about 5 seconds, your driver's license, you're in, everybody's happy, eating and feeling very safe, unlike the way I felt here in a restaurant in Lenox. And now that Omicron is about to be upon us, I sent Jim an article today by an attachment, and please, Jim, feel free to disseminate this article I sent you, but CDC is now predicting that next month Omicron will be the dominant bug around here. It's, as you all know better than I, it's highly contagious. I believe the R value is 2.5 to 3, which translates to a doubling time of 3 to 4 days. And some models by people outside CDC have suggested this winter, we could even be hit by the triple whammy of influenza, Delta variant, and Omicron, which could put a great burden on the healthcare system, make a lot of people sick, kill some people, I hope not, but especially in areas with low vaccine rates. Now, as you know, Berkshire County has about a 70% rate of full vaccination, whatever that means now. Nationally, only about 27% of people with full vaccine have gotten the booster. Now, so even if half of the people in Berkshire County who are vaccinated got the booster, that means if you go into a restaurant now, that means that 2 out of every 3 people will not be fully vaccinated against Omicron, not be effectively vaccinated against Omicron. And, in a county with a high transmission rate, the notion of walking into a room full of loudly talking, unmasked people, 2/3 of whom are not effectively vaccinated, next month, that's going to be a very scary proposition. And I anticipate this may make people afraid to go into restaurants which, obviously ramifications for the restaurant business around here. So all I'm recommending is just part of a multi-layered approach that epidemiologists are recommending now. That is, I think we could anticipate that requiring proof of vaccination in places like restaurants will greatly reduce infection rates, or somewhat reduce infection rates, but to a much greater extent reduce rate of serious illness and much less stress on the healthcare system, and perhaps reduce the risk that we'll have to go through a shutdown as the winter goes along. So that's why I think the science supports this recommendation of asking restaurants to provide proof of vaccination. I think it's a relatively simple thing. That concludes my remarks.
Thank you, Dr. Wall. Thank you.
Thank you, Dr. Wall.
Does everybody on the board understand what Dr. Wall is proposing?
Yes.
Okay. Now, this is not a specific agenda item for us to decide upon tonight, but since Dr. Wall was invited by Diane from the Lennox board, I took it upon me to invite some select board people from some of the towns. And so we have, I think Mary Beth Mitz is here from Lennox. Are you here, Mary Beth? I think I saw you before.
Mm.
Yes.
Yeah.
And so Mary Beth, do you have anything to say about that from a select board point of view?
Well, from a select board point of view, I would say that it's going to be very difficult to enforce.
Mhm.
I mean, I think if restaurants take it upon themselves to do it and they dedicate a staff member who's going to, stand at the door, check those cards as people come and go, that is something that the restaurant itself would have to take up. There's very little way for the town of Lennox to, post police officers or public health people at the doors of restaurants to check that out. It would have to be an individual restaurant that would agree to do that. I do understand what Dr. Wall is saying. It makes a lot of sense when you're in a restaurant and, clearly people are just chattering and, enjoying their meal, but they're also, socializing. And you don't know if these people are visiting from outside of town or if they're vaccinated or not. That can be quite concerning, but it will put somewhat of a burden on those restaurants. And so I think we can only hope that restaurants will voluntarily engage.
Mary Beth, thank you very much. I also invited our Stockbridge chairman of the select board, Roxanne McCaffrey. I think she's here now too. Roxanne, are you here?
Yes, I'm here.
Would you like to say something about that too?
Can you hear me, Charlie?
Yes. Can everybody
Yeah,
hear?
I agree with Mary Beth. Yeah, I agree with Mary Beth. I feel that it's unenforceable in terms of a mandate. I do think it places a burden on those restaurants who would opt to choose to do that. So I do have some concern around it. But I think the main concern is that it is unenforceable and very difficult. And then where does contact tracing come in? Will they be required to take names and contact numbers of everyone, which is something that happened early on in the shop that I work in Lennox. We did have a contact tracing list. And of course, everyone would not agree to sign that. So there's some difficulty here, and I do understand what he is saying, but I do have concerns, and I agree with Mary Beth.
All right. Thank you, Roxanne. We have somebody from the Lee Chamber of Commerce here. Who is that?
I'm right here. I'm Colleen Henry from the Lee Chamber of Commerce, and I have to agree with Mary Beth and Roxanne. It would be a huge burden on the businesses in Lee. And I think that if a restaurant determines themselves to do it, then they can do it and they take on the responsibility. But I don't think it would be really helpful for our business community. That's all. And I see that the Lennox Chamber has their hand up, so I'll let Jennifer talk too.
Go ahead, Jennifer.
Hi, everyone. Thank you for letting me be here on this meeting. I reached out to all of the restaurants in Lennox, and overwhelmingly, they were against this kind of mandate. They feel that they would lose more business, and if they had this mandate in place, and also, quite frankly, they just don't have the staffing to put someone at the door. I mean, we're in a, we're obviously in the middle of the great resignation, as it would be, and also in this slow season, and they're just getting by as it is. And I think that the restaurants that are very concerned about it, they will go ahead, they can institute it themselves or have, stronger mask regulations. I just, same thing. I've been to places, I live in South County, and I've been to places in Great Barrington. Same thing. I went in and I was very surprised. They had live music going, but I think that if people are vaccinated, and if they feel comfortable going to this environment, they should be allowed to do so, even if they're not vaccinated. And if people are uncomfortable, then they have to find another place that maybe where they feel more comfortable. I just don't think this is a good idea to put this on the restaurants.
Okay, thank you, Jennifer. Now, I see there are other hands up. What I'd like to say here is just, first of all, to the board members, this is not a specific agenda item, so I'm not going to ask the board members to discuss this now. And I see there are some other hands up. I'm sorry, I'm not going to create a discussion at this point. What my interest was tonight was to make it clear to the rest of the board members, and I hope that the public has done that this item needs to be discussed in detail at one of our future meetings. And so that we have it on an agenda, so the public is fully apprised that we're going to be discussing it, so that we have people who are prepared with information that we can ask them questions and give them data and get facts so we understand what we're talking about. And I think that it's such an important issue that I'd like somebody from the board to make a motion that we table this item at this point and bring it up at a future date, perhaps right after the holidays, so that we can revisit it in a proper way.
I so move.
Any second on that motion to table? Do we have any discussion of the motion?
No, it's a good idea.
Okay, can we vote on? Does everybody agree with that motion?
Aye.
Okay.
Aye.
All right, anybody opposed? Okay, thank you all.
Mr. Chair, if I can add to the further discussion, I know there's a lot of people on here. We can definitely start to advance the next board meeting. I can send out a poll and try to get that facilitated, and we can make an announcement. I know Clarence from the Eagles on here. I can let him know when the meeting date is. I can let the chambers know, and I can let all three towns know when that meeting is. So when people do come to the meeting, they'll be understand what date and time that will be. So we'll get ahead of that on the date and time for that next meeting, so we have a good discussion on that.
Yeah, thank you, Jim. There are always pros and cons to things, but I think one of the pros of having another meeting a few weeks hence is that the Omicron will become more defined. And I think we're going to see a little bit more about that, so we can weigh in much more intelligently in that direction.
Yes.
So let's see now, the next agenda item is department updates. Jim, do you have any department updates you'd like to bring up?
No, just really two staffing announcements. As the board knows, Jonathan Pierce, who's been one of our inspectors that's been with us for quite some time, he's been promoted to chief sanitarian. He's really advanced his credentialing and certifications, and he's just all the staff are excellent. But I want to announce that. And Jane Smith, who was on here, I think she jumped off. Who Jane's as a registered sanitarian as well, who has a lot of experience as a health agent in other towns. She's been hired as the shared services coordinator for the Southern Berkshire Public Health Collaborative. I had her on here to introduce her to the board, but I think there's just a lot going on. So she'll be starting that in early January. And again, to echo this whole new theory of this great resignation, that's a real thing that's definitely happening. There's a lot of people, there's this mass exodus going on. And, we, fortunately for Tri-Town, we've been a little bit immune to that. And we've been able to really attract and retain really, really good staff that, I think we're all exhausted from COVID, but I just want to remind people, like, Tri-Town is one of the very few departments outside of police and fire that never shut down. We've been working around the clock for 20 plus months. And, when people were working remote and enjoying their families and kids, we were at the office really hammering things away. And it's just, it's a testament of having really good staff working with the community. And, we didn't create COVID, and we just sort of have to work through this together. It's very polarizing topic. It's not getting any easier. And I think we're all in this together, and there's no borders in public health. So whether we do or do nothing, we have to do this together as a community, and we need to strengthen our relationships and partnerships, not further divide them. So thank you, Mr. Chair.
Okay, so I think that's the end of the agenda. Does anybody on the board have anything to say? Can I have a motion to adjourn? Is there a motion to adjourn the meeting?
I make a motion to adjourn the meeting.
Thank you, Diana. Second. please.
Second,
Henry, second. All in favor?
aye.
Right.
Have a good evening, everybody. Thank
Happy
you all for
holidays,
coming.
everybody.
Thank you.